Hi, my name is Dr. Kabir Sardana. I'm currently working as a professor in the Department of Dermatology at RML Hospital, Delhi. The dermatophytosis epidemic in India is an ordeal for patients and us alike. I've done extensive research on this topic and poured all my knowledge and research into this book entitled Fungal Infections, Diagnosis and Treatment. Today I'm here to discuss this book and answer some of the questions asked by renowned dermatologists and friends from different parts of India and Nepal. So let's begin.
Dr. Belasha, Professor and Head BJ Medical College, Civil Hospital, Ahmedabad. Let me congratulate Dr. Kabir for his book on fungal infection, diagnosis and management. We all know Dr. Kabir, who has done pioneering research work in the field of dermatophytosis. And this second edition has been written lucidly, and I am very sure that it is going to give a lot of cues to the treating physician how to manage dermatophytosis effectively and efficiently. But then I have a question for Dr. Kabir. We have been talking about recalcitrance all this time, but do you think that we are facing real resistance to this dermatophytosis? Thank you.
Thanks, Dr. Belasha, for your question, and of course, thank you very much for giving a forward for my first edition, and again for this edition. Now, drug resistance among dermatophytosis is very uncommon worldwide, but in India, it's not true. So, I agree with your point of view that there are patients who have got resistance. So, correct statement would be that based on the mutational studies and MIC data, possibly terbinafine resistance is common in India. So, this is something very important to understand. Number two, remember that though we have studies from this country that show resistance to terbinafine, it can be surmounted. In fact, a study from our department has shown that increasing the dose to 250 mg BD can surmount this resistance in a large proportion of patients. Next, we have a question from Dr. Kandhari, who is a very senior dermatologist in Delhi and a very good friend.
Let me at the outset thank Dr. Kabir Sardana for having written this wonderful book on fungal infections, diagnosis and treatment. I've gone through this book and I have thoroughly enjoyed it. On the topic of recalcitrant dermatophytosis, I would like to ask him a question. That is this recalcitrant dermatophytosis predominantly an Indian phenomenon? And if so, why? Why has it happened now? What could be the reasons? In my mind, the reasons were that it is because of use of local steroids along with antifungals and the rise of T mentagrophytes. These are the two main factors, both leading also to an increase in Th2 response. Because to my mind, all other factors, except like for instance global warming, increase in atopy, metabolic syndrome, change in clothing, all have remained the same all over the world. So why is it happening predominantly in our subcontinent? That is the main question that I need to ask. Also, there are many cases which I have seen who, in spite of the fact that we give them treatment for almost 8 to 12 weeks, yet they keep on coming back. And that also I give itraconazole sometimes in the dosage which is double. That is 100 milligrams morning and night. Should we in these cases then replace it with terbinafine subsequently, and for how long? Because there are no guidelines to this, so how long should we give it? These are the two main questions that I'd like to put forward and would want to see what his reactions to this is. And lastly, again, I must compliment him again for the wonderful book that he has written. Thank you.
That's a wonderful question, Dr. Kandhari, and I thank you for the review of the book and for encouraging me for this particular book. Now, to answer your question, now this concept of steroids being the main cause, remember there's no logical reason why a steroid would cause resistance in our country. And mind you, if that be the case, why only to terbinafine? Why not to itraconazole? So I don't think steroids can really cause resistance by itself. And also, mind you, steroids reduce Th2 response. If that be the case, we would not be having this problem in our country. Number two, this concept of the species being the cause and being discovered recently. Mind you, no one knows what was happening 5 years back. This kind of genomic research has not been done before in the country. We've not done PCR. We've not had online database analysis to verify species. So in the past, if you remember, we only did culture. So it's very possible that this particular species shift has happened many years back, and we are using this particular concept to explain this finding today. And so I don't know why we keep saying that this is happening now, it's not happened previously. So I don't think that's quite true. Now I'll give you a very simple example. The species story is actually much like the JAK-STAT receptors in alopecia areata. We keep saying that we discovered it 5 years back, but it was always there. Similarly, the so-called new species may have already been there, and no one was doing any analysis of PCR and mutation analysis of those species. Thirdly, yes, resistance is seen across the world. The prevalence is definitely lower. And remember, if it is there in Europe, it's there in America, it's there in Southeast Asia, how do you explain this phenomena all over the world if they don't use steroids? So a very simple way to answer this question and to know why it's only to terbinafine is like this. When you give an antibiotic or antifungal drug for a long time, what happens? Number one, there's an increase in MIC. Number two, the MIC exceeds the breakpoint. Then there's a mutation, and then there's clinical failure. In India, we've been using terbinafine for the last 50 years. There's rampant misuse of this drug for every condition by practitioners of all specialties. And that actually explains why the problem in India is so specific for terbinafine. Now, it might happen to itraconazole if you keep misusing it, but I feel that the cause of terbinafine resistance is purely misuse and not steroids or even species. Okay, so thank you very much for being with me through this session, and I've covered all the points in detail about the subject. If you want to buy my book, Fungal Infections Diagnosis and Treatment, you can buy it online from Amazon, Flipkart, or also, of course, you can go to your nearest FDC representative and he'll get you a copy. Thank you very much and goodbye.